Hello and welcome to Daytime. We have got a great show for you today, but first, we didn't have a show this Wednesday, which means we didn't get to do our Winning Wednesday prize, but never fear, we're going to give away our final prize pack from the Pickering Town Center today. And Jennifer Laughlin of Bowmanville, you are the lucky winner of this Carberry soap gift basket. Congratulations, we'll be in touch soon. And if you want to win with Daytime, and I know you do, you're going to check us out online at rogerstv.com/Daytime Durham and click Win with Daytime. Well, it is Friday, and that means we are joined by our doctors from the Rouge Valley Health System. And today we have with us orthopedic surgeon Dr. Jesse Slade Shantz. Great to have you here.
Thanks a lot.
So we are going to talk all about your specialty and all about what it encompasses. But first of all, tell me what drew you to being an orthopedic surgeon.
Well, it actually happened as a bit of a surprise because I was thinking about going into a medical field, not a surgical field. And then I met some great mentors who seemed like they were a lot like me. And then I got to see how they could treat patients based on their injuries and on what they did for a living. So I thought just understanding the patient, giving them the right surgery, and seeing them get better afterwards was just an amazing opportunity. So, so that's what really drew me to it.
And it really changes people's lives, right? When people have these injuries, they're in a lot of pain, and they're not sure if they'll ever have that kind of mobility again. And I think orthopedic surgery really changes people for the better.
It's different than a lot of other surgeries because a lot of other surgeries involve cutting things out and, you know, changing people. We actually tend to try to put people back together and make them whole again, and I think that just creates this amazing relationship with the patient that I really love.
So let's talk a bit about what orthopedic surgery entails, so that we have some context. Are we talking about the shoulders, the knees, the feet, where in the body?
So basically everywhere from the neck down, all bones, muscles, and joints, ligaments we deal with.
And who is coming to see you? What kind of injuries do they have that they need to see an orthopedic surgeon?
So me personally, I see mostly shoulder injuries and sports injuries.
And so are these injuries debilitating in terms of they can no longer move because of a shoulder injury, or are you seeing people who just have some pain, it's in this general area, and I'm not sure what to do about it?
Both. So there are some people who come into my clinic who have intractable shoulder pain. They feel like there's a knife or a hot poker stabbing them in the shoulder. That's typical of rotator cuff tendonitis. And then there are people who have just had sort of this nagging pain for a long time that wakes them up at night. They haven't really done anything with it for maybe 5 years, or they've gone to see their doctor, tried some Advil, and they realize that they just can't live their life that way anymore. They can't concentrate at work, but it hasn't been something that's been like, you know, taking them to the emergency department.
Right. And so are they referred to you by their family doctor?
Yeah.
Or can they call you directly?
By their family doctor mostly. Some of the people who have really bad pain come in through the emergency department, and that's a direct referral from our emergency physicians at Rouge Valley. But the majority of people come through a referral from their family doctor, and I know some of them help assist in surgery, so I know them and they know the kind of things I'm interested in. Some of the family doctors I know through other personal connections, and I think a lot of people just see that I send them a note back and they see, oh, well, I took care of this trauma problem or this shoulder problem, and then they'll refer me other patients they have.
Okay, so walk me through the process then. If I have an injury, let's use shoulder for an example. I feel some pain, I'm not sure what it is, my family doctor said I'm going to refer you.
Yeah.
What would the process be like then when I come to visit you?
So the first thing to mention is that when you have a shoulder problem like this, there are some things that need to be done beforehand to make sure that you need to have an orthopedic surgery consult, because we want to make sure that we get you treated in a timely fashion. So things you can do that are simple are just take some anti-inflammatories to try to lessen the pain and inflammation in the shoulder, or Tylenol if it's a severe pain, and it may help somewhat. Family doctors can prescribe other things that are stronger, like other anti-inflammatories. And then the next step would be physiotherapy as well at the same time. Physiotherapists are really good at removing people's shoulders, helping to get muscles strong again. But I think a lot of people don't understand that they actually focus on pain control as well.
Oh, really?
And there can be a lot of benefit from a physiotherapist, although it's not covered, you know, in just getting rid of pain for you.
So before they'd even need to be referred to you, if they
Right.
saw a physiotherapist, there is a chance that their pain could be lessened.
Exactly, or their motion can be increased, sleep can sometimes improve with that, and that would be a big win because then you don't wait for the referral. I think it's about 2 to 3 months to see me. My colleagues at Rouge Valley have a longer wait period. I try to keep mine as short as possible. And then the next step would be that your family doctor would probably send you for x-rays just to make sure there's not arthritis, which I think we should talk about that, probably the difference between arthritis of the shoulder joint and rotator cuff tears because they get confused a lot.
Okay.
And then the next step would maybe be an ultrasound, which can often determine whether there's a rotator cuff tear or anything else going on.
Okay, so the doctor has determined then that they do need to see you. We've had maybe an ultrasound and there is something wrong.
Yeah.
What is the surgery process like? Are we going to be waiting for months and months and months to get into surgery? Is it something that gets taken care of rather quickly?
So that depends. So when people come with a long-standing problem, then I think there's a bit more time to arrange things. The family doctor will refer to me, and I code those referrals, and I try to get people in as quickly as possible, but also try to shuffle people in terms of whether they have something that needs to be treated right away, or whether it can wait a month to be seen, sort of thing. And so I do that, and based on all the referrals I get about maybe 15 or 20 a week.
Oh, wow.
And so I'm coding those constantly. And the next thing is that the patients all come in, they're scheduled for my clinic. I do a Monday clinic at Rouge Valley Ajax Pickering, and I see patients there and I try to sort out what the next step for them is. I look at their imaging, I hear their story, I hear their goals and what they want to do with their shoulder, what they can't do with their shoulder, and that lets me start to figure out what's the best treatment for them. Some people, it's an injection in the shoulder because we want to try to lessen their pain, we want to try to give them some relief and let them do physiotherapy. Some people, it's immediate surgery, like somebody who has a fall on ice, grabs something, and then feels a tearing feeling in their shoulder or feels pain, even pain the next day. That's a different story because that's an acute tear, potentially. And so if they have a rotator cuff tear, fixing it within about 3 months, give or take, is pretty important to give them a better chance of recovery. So I try to prioritize those patients and then make a little bit of a different, I wouldn't inject their shoulder, I would be more on the side of fixing their rotator cuff if they're interested.
So that clinic is a really important part of what you do because it means that you get to really understand who the patient is, what they've been suffering with, and kind of where they want, what they want the end result to be.
Yeah, at University of Western Ontario, where I did medical school, we were taught something called patient-centered care. And so the idea of that is that you learn around not only the disease and the illness, which the illness is the way that the patient experiences the disease.
Well, I'm going to cut you off there because you are staying with us and we need to take a break, and there's a lot more to come with Dr. Slade Shantz right after this. Well, welcome back to Daytime. We're here with Dr. Jessie Slade Shantz of the Rouge Valley Health System, and right before the break we were talking about patient-centered care, and you were talking about your studies at UWO and how that was so important to you.
Yeah, and I was starting to talk about the idea of what a disease is, what an illness is, because I think medical school is basically focused on diseases and learning them, but really the illness is how the patient experiences that disease, that pathology, and then getting a step outside of that is actually thinking about the patient themselves and thinking about their context. So, you know, here in Durham, we have a context where there are a lot of people working in shipping and receiving jobs, and I see a lot of them in my clinic, and that involves a lot of lifting. I see a lot of people who are involved in public transit, who are driving, and I have to think about how turning the wheel of a bus affects them when they have their rotator cuff injured. And so that understanding the patient better is really what I get at a clinic. And it's really, in clinic, it's deciding what's the best for that person. It's not a cookie cutter. And you know, the 93-year-old woman who lives on her own, is independent, has a rotator cuff tear, which decompensates and becomes painful, an injection can be an amazing thing for them, you know, because it can get them feeling better. And it's not surgery, it's not some long recovery, there's not a huge risk with it, but it can help them to be independent still.
Let's talk about that rotator cuff tear versus arthritis in the shoulder and how we kind of know the difference and how it affects people differently.
Yeah, I actually brought a model so we can talk about that a little bit. So this is a model of the shoulder, and this is looking from the front. And so here, this bone out in front here, that's the collarbone or the clavicle. And this is actually the humerus, which is the arm bone. And so it sits in this cuff of tendons here, which are obviously rubber on this. And it is, these are the rotator cuff tendons. And so you can see that they're actually like a hood over top of this bone, and they insert out here on the outside of this bone. And So the humerus is in the joint here, and it's hard to see inside of here, but there's like, it's almost like a little golf tee that it sits on, and they talk about that. It's like a golf ball. It's this big thing sitting on a golf tee, which is really small, and that's the part that gets arthritis, and that's really uncommon actually to have arthritis in your shoulder joint because we don't walk on our hands, so there's not that much stress going through, and so there are some people who get some arthritis of the shoulder joint, but it's pretty uncommon. It's maybe like about 5% of the people I see, if even, and I'm a shoulder specialist. And the majority of people, if they get arthritis, it's actually in the joint here that you can't see. It's covered over by what is a capsule, and that's the acromioclavicular joint, the AC joint. So that's the joint between the collarbone and the shoulder blade back here, which is underneath these muscles at the back here. So basically that's the joint that gets arthritis, and often it's not the big problem for people. It shows up as arthritis on an x-ray, but arthritis on an x-ray doesn't matter if there's no pain associated with it, and that's one of the things I sort out in clinic. And potentially, if it's a bit confusing, sort out with an injection in that joint to make it numb, so I can show a patient, okay, how much of your pain is actually related to that arthritis in that joint versus something else going on. And the big thing that causes pain for people is actually, it'll be really hard to see on air, but there's a space here underneath this kind of shoulder tip bone, the acromion, which is pretty narrow, and it gets narrower depending on how your shoulder position is and on the way you're made. And so the idea is that there's inflammation under there, and when you lift your shoulder up, then the space gets less and less because of this bump on the side of the humerus right there. And there's pinching in the shoulder. And if there's inflammation plus the pinching, then you get into big problems where you have pain whenever you lift your arm up. And so that's what we call impingement, and that's what we think is one of the causes of chronic rotator cuff tears. The ones that come in 5 years, it's been bugging me, and there's a tear there, versus somebody who falls and has an acute event of saying, ouch, you know, there's something happened in my shoulder, and that's more of a traumatic tear. Those people may not have any inflammation above here, and they may not have the sort of pinching, the bony pinching that happens.
So is there a way to prevent these kind of injuries? Is there something that we can be doing, especially for people that you were mentioning that are constantly having to move their arms? Is there something they can do to prevent injury?
I think that there hasn't been a lot of study on that, actually. There's been study on hip fractures, for sure, and the idea of preventing falls or padding the hips, that there are actually hip protectors that work, but they're just really not very nice to wear, so people don't wear them. In the shoulder, I don't think there's as much of a focus on prevention. One of the things that I could say is maintaining strength and physiotherapy when you have a shoulder injury, because what people tend to do with a shoulder injury is their scapula or their shoulder blade tends to elevate and protract, which means come forward, and the muscles here are just constantly activating, and there's a lot of pain that happens in the shoulder, in the trapezius muscle, which is at the back of the neck, and then also in the rhomboids, which are right on the inside of the shoulder blade. And so if we could get everybody early and have physiotherapy, then I think a lot of people who end up having chronic shoulder pain could actually be helped quite a bit.
Well, Doctor, you've given us some really fantastic advice. We love having our Rouge Valley doctors here, but we also really love when you bring a model, because that made a lot of sense to me. And now, I think I'm a lot more informed, so thank you so much for being here. Really appreciate it. And you guys don't go anywhere. We need to take a break, but we're going to be talking all about jewelry when we come back. You won't want to miss it.